I'm Nicole, I'm one of the prenatal educators here at Sydney Adventist Hospital, and in this module we'll be talking about the physical and the psychological postnatal care. For various reasons and obvious reasons, the source of pain predominantly post-birth will be dependable on if you've had a vaginal birth versus caesarean birth. So for a vaginal birth, depending on how traumatic the birth was, obviously the vagina area and the perineum can be a source of pain. Bruising, swelling, that sort of thing that you may be presented with. So the ice packs on the ward, they're located up and down each wing of the ward in the freezer, and there's little sleeves to place on top of that. Can be a very, very useful strategy to use. Just place that little ice pack literally into your underpants, and that can provide an anti-inflammatory for that painful and swollen area. Feel free to use as many as you need to. Send a support person up and down the wings to gather those for you. Post-birth pains is another source of pain that mums experience, and this is predominantly the uterus contracting again and reducing its size back to pre-baby size. So don't be alarmed if you start to get a little bit of menstrual-like tummy pain again after birth. That's classed as post-birth pain and completely normal as the uterus contracts down to shrink back to normal size. So that's another source of pain as well. Talking about a caesarean section, obviously very different birth to a vaginal. So the caesarean mums will obviously have a tummy wound that they need to be taken care of. So any coughing that you're doing, you need to use pillow support over that wound, and you might like a little bit of pillow support when you're trying to change positions and getting up from sitting and even rolling over in bed, just to aid that area and just to give that wound a little bit of extra support. But for both vaginal and caesarean section mums, the best recovery is to get up and moving fairly quickly. So for a vaginal birth, depending if you've had an epidural or not, if you haven't had an epidural and you can completely feel your legs, you can be up and showering within half an hour of giving birth. And some mums choose to do that, freshen up, feel a bit more human again, and then come back for cuddles with their newborn baby. For other mums, you may need a little bit of extra time in bed depending on how traumatic the birth was, and if there has been an epidural, you'll obviously need to wait until that catheter has been removed and you've got feeling in your legs to be able to get up and actually enter the shower. So that's talking about that epidural, the same factor for caesarean mums. So it's likely it won't be till late afternoon or even the next day that you're actually up and out of bed and showering. So that's just a little bit of difference between the vaginal recovery and the C-section recovery. But both need to get early movement. So walking up and down each wing daily and a few times a day is really, really important. It gets the blood flowing, prevents blood clots, and just assists with normal healing. In the module where I discuss the pelvic floor and the implications of pregnancy and birth on the pelvic floor, I discuss that you need to start activating these muscles pretty much from day one, day 2 post-birth. Start trying to get some activation of your pelvic floor and get those firing up as well, because that will assist with an earlier and an easier recovery postnatally as well. Breast changes are also a source of pain. So as your milk comes in, day 2, day 3, this is another physical component and a source of pain where mums will experience discomfort. So as your milk comes in, your breasts will become enlarged, hard and quite uncomfortable. So again, use ice packs to assist with bringing down that inflammation and assisting with the pain that you're feeling in your breast. And obviously once the milk comes in, make sure there's no engorgement happening and no inflammation, which you'll know if they're red and hot, but the midwives will be all over that, coming in and asking you lots of questions and checking to see what's happening at your breasts as well. But the ice can be a really useful technique to use on your breasts as well. Some other resources available to you are the Australian Breastfeeding Association. So that's a great phone hotline that's always manned. You can ring up at any time of the day and you can have your breastfeeding questions answered and know that there's support always there. Likewise, if you get home and you're still struggling with breastfeeding, attachment might not be happening, or you might be getting cracked nipples often and you just know that the attachment isn't on point, don't hesitate to make an outpatient appointment with a lactation consultant. You can then come in as an outpatient and have an appointment with a lactation consultant who can just assess what's happening, look over an entire feed and just check that attachment is happening and give you some tips. So you don't need to sit at home and struggle on your own. Breastfeeding is definitely a skill that you and baby need to learn together, and the lactation consultants are there to assist you. I did mention the Tresillian and the Karatani. They're community services out there available to assist with settling, feeding and also sleeping issues. So don't hesitate to also try and get a referral there. They've got day stays and also 3 to 5 day stays where you and baby can be inpatient, and having a wealth of support around you to try and get those foundations looked at. So lochia is the bleeding that mums, vaginal birth mums and caesarean section mums will experience, and the bleeding that will occur can occur up for 6 weeks postnatally. This will be checked out with your obstetrician at your 6-week checkup, but just to know that a 6-week period of bleeding postnatally is completely normal, and that's for both vaginal mums and caesarean section birth mums as well. Well, another physical aspect post-birth, and one of the common fears of new mums, is actually opening up your bowels for the first time. And that's fearful for both mums who have delivered vaginally and also mums who have delivered through C-section. Now with a C-section, it's obviously pressure through the abdominal region when you're trying to open up your bowels, and for the vaginal birth mums, it's obviously the pressure on the perineum, which may have had a little bit of trauma in the vaginal birth. So either way, no matter which way you've birthed, I want you to not be too frightened of it, and once you've done it for the first time, I guarantee you'll have a lot more questions because the midwives won't be asking you anymore if you've opened up your bowels, and you can tick that off your list that that's actually been done. But if you're struggling opening up your bowels and you feel like you are a little bit constipated, just ask the midwives. They've got some laxatives that you can use just to soften your stools, because pregnancy does play havoc with the fibre and our stool configuration. So don't be afraid to ask for some laxatives. In each room where you're staying on level 10, there is a footstool. Okay, so I want you to use this when you do go to the toilet, and basically you need to put it under your feet so that your hips are raised and your knees are raised up higher than your hips. It'll just make it for a better position for your pelvic floor when you're on the toilet. One key factor I want to talk to you about is when you are opening up your bowels for the first time, you need to have some time, and it doesn't need to be rushed. So this could be an optimum time where the support person takes out visitors to the visitor wing, and you can say, look, I just need to have a shower, or I'm just going to jump back into bed and maybe have an hour's rest and have some time on your own. You definitely don't want to rush this because you will be a little bit anxious and you'll just put extra load through your pelvic floor that doesn't need to happen. So by using the footstool underneath your feet, your knees will be raised higher than your hips. You actually want to lean forward and have your elbows resting on your knees, okay? That will get you into the prime position of allowing your pelvic floor not to be too tight and to be nice and rested where you need to open up your bowels. On your hand, I want you to actually wrap your hand with toilet paper, okay? So that nothing can get onto your hand. But what you can do when you're about to open up your bowels is just place that wrapped hand on your perineum and just support that area. Remember that for the vaginal birth mums, that's been an area that has had some trauma placed through it. So just support it up so that it's not bearing down as you're opening up your bowels. And quite often just those techniques with the footstool and a little bit of support on the perineum and having soft stools, maybe through a laxative or maybe just having extra fluid on board, can be enough. And I guarantee once you've done it for the first time, the fear has gone. Okay. For the C-section mums, for the first 6 weeks after the birth, You're not supposed to lift anything heavier than the weight of your baby, and you're actually not cleared to drive for 6 weeks. So you'll have your clearance with your obstetrician at 6 weeks, but I would encourage you just to check with your individual CTP insurer if you are covered for earlier clearance of driving, even if you were to be cleared at 4 weeks, because not all insurers do cover you in case you are involved in an accident. But the lifting component, just be very, very easy on your body and try not to lift anything heavier than the weight of your baby. So that means a load of heavy wet washing you should not be carrying. So that's what we'll go into in the next module of who can be available to help with certain day-to-day tasks when you're recovering physically from your caesarean birth. Both vaginal birthed mums and caesarean section mums need to activate their pelvic floor and their deep tummy muscles, the transverse abdominis muscles, very soon after birth. So pelvic floor can be activated day 1, day 2. For the mums who delivered vaginally, the deep tummy muscles, the transverse abdominal muscles, can be activated from about day 2, and we give the caesarean section mums an extra day from about day 3. And that's your deep tummy muscles, not your sit-up muscles, not your six-pack muscles. They're the deep tummy muscles that help to support the front of your core and help to support stability of your lower back and general pelvic stability as well. So the pelvic floor muscles, which we discussed in the pelvic floor component, and as well as these deep transverse abdominal muscles, need to be switched on together to form the base of your core unit. If you think of the core unit as a cylinder, at the base of the cylinder is your pelvic floor. At the front of the cylinder is the deep tummy transverse abdominis muscles. At the top is the diaphragm breathing muscles, and at the back is the multifidus. So what we're most concerned with is the pelvic floor at the base and the transverse abdominis muscles, the deep tummy muscles at the front. And we want them to start getting activated because after birth, you'll feel very jelly-like and very empty, hollow inside. You'll still look about 4 months pregnant, even after giving birth, and then we need to start to close that gap and give you the strength back in your core, and that's achieved by activating your pelvic floor muscles in conjunction with your deep tummy muscles. Physios will pop their heads in and double check that you're okay with that activation, and just remember on the ward there's a physio exercise classes, and postnatally if you're having trouble activating your pelvic floor or your transverse abdominis muscles, remember there's a postnatal class, mums and bubs exercise class on site pending COVID restrictions, or don't hesitate to book in an outpatient appointment with a women's health physiotherapist just to get those areas checked and make sure that you've got good activation of those. Talking about the physical changes with regards to the breast, don't forget to attend the breastfeeding classes that are happening daily on the ward, and get to those classes while you're here as well, and get as much support as you can whilst you're inpatient. There's many psychological impacts that also occur after having a baby for both mums and dads, and they need to be spoken about so that people don't suffer in silence. So having a baby will completely change your life for the better, but it will definitely change your life. You go from having complete control over your day, fitting in, eating when you want, you obviously go to work, you socialise, and now you bring home a newborn baby without a manual, and it's up to you to work out how to care for this newborn baby. So you no longer have the freedom of just living your life how you want it. You now have to fit in a little baby into the picture as well. So be easy on yourselves and support one another. And I would encourage you to talk to your friends and family and people who have been through it, because they will be there for you and they will understand what you are going through. Baby blues is a very common analogy that happens, and it lasts up to a couple of weeks postnatal period, and it's very normal. It's an emotional time, it's a roller coaster, especially around day 2, day 3 when the mum's milk comes in. That is a very, very emotional couple of days for mum. So support person, I'm going to put you in here. This might be your role of possibly closing the gates to visitors on those couple of days when mum is a bit of an emotional wreck and trying to establish breastfeeding and getting things under control. Obviously, parents and siblings want to come and you want to show your new baby, that's completely fine. But maybe the extended friends, if they're due to come on the day of day 2, day 3, and you can see that mum's struggling, it might be your job to just make a little phone call and just say, hey, we've had a rough night. Can we reschedule this visit once we get home next week? I'm sure they won't mind, but whilst you're here in hospital, the priority is to get things under control and use the support available. So whilst you're in hospital, mums need to utilise the assistance and support of midwives and the knowledge of the midwives, the lactation consultants and the physios, and obviously seeing the obstetrician and paediatrician on their rounds. If you've got visitors coming in and out constantly all day long, not only are you going to be exhausted and mum's not catching up on the sleep that she's missing, but she might also be missing out on that opportunity to get that breastfeeding established and under control before you actually head home, where there's not going to be the support available. So I would recommend you just to tread carefully on those day 2 and 3, pull the pin on visitors if needed, and I'm sure that they will understand. So when you're here on the ward, as I've said to you, the breastfeeding classes, the baby care classes, the bathing class, the physio exercise class, try and make the most of all those classes and try and get to as many as you can, because when you're here, it's all the help that you need, and once you get home, you don't have that available help. So try and utilise it and get things established and under control as much as you can before you get home and try and find your own way along this parenthood path. Dads need to be cared for too, and mums also need to take a look out for the support person and the dad's mental health as well. So postnatal depression affects 1 in 5 new mums, that's 15% of new mums, and 5% of new dads. Thankfully now it's spoken about a lot more. There's not so much a stigma attached to it, but you do need to talk about this if you're noticing signs and symptoms of postnatal depression, because it's very real and it's more than just the baby blues. If the baby blues continue on for more than the couple of weeks after the baby's born, and you're starting to notice symptoms of irritability, feelings of hopelessness, not wanting to see people, not wanting to socialise at all, feeling very withdrawn, very depressed, very fatigued. I mean, you are dealing with sleep deprivation, so that can sometimes be hard to interpret, but just a very different vibe of the new mum to what you would normally see her as. Then start to have some open communication and dialogue about that, and just see if we need to start talking about it. And the first port of call would be a GP appointment. Just starting to get it talked about, seeing if a referral to a psychologist is relevant or even warranted. The GP might wish just to see how things go, but at least you've started that process of talking about it. In the more serious circumstances, obviously a referral to a psychologist, psychiatrist can be made, or a referral to some of the community services, so Tresillian and Karatani might also be needed. If there's medical issues of the baby which are contributing to the postnatal depression symptoms, then obviously referral to the paediatrician. You will have your 6-week checkup with the paediatrician anyway. That will happen after you've left the hospital. But if there's obviously medical issues, you'll have that ongoing care from the paediatrician. But postnatal depression is very, very real, and I want you to have those open communications and not shy away from it if you're recognising those signs and symptoms. There's lots of help out there. There's the Panda Association, there's Lifeline, there's Beyond Blue, there is Black Dog Institute and the Gidget Foundation. So if needed, obviously do a little bit of extra research and have that chat with the GP initially, but there is lots of help out there. Both of you will be sleep deprived in the early weeks after leaving hospital with your newborn baby, and you're both trying to find your way on this parenthood journey. People will often say, how can I help? Friends and family will say, how can I help? And the best advice I can give you is for them to bring over a cooked meal. That is one less burden that the mum has to think about doing, especially when dad's support person is back at work, to try and get a meal onto the table when possibly the mum's had a very rough day, rough night, unsettled baby, has had a koala attached to her all day and hasn't been able to put down the baby. Having a meal there, whether it be in the fridge or whether it be in the freezer, knowing that you've got a nutritious meal on the table is a huge weight off her shoulders, and both of you are getting nutritiously fed, and you're not going to grab a piece of toast that evening again, which you may have already had a couple of times this week. So either ask friends and family to cook meals, you might start to do some online shopping so you don't have to exit the house to try and find time to do that. You might utilise some of the frozen meals that you can already pre-purchase. Or in the first couple of weeks of maternity leave prior to having birth, try and get some cooking done. So some big batches of lasagna or spaghetti bowl or stir fries cooked and frozen, so that on those days when you're having really tough days, you know that you've got something in the freezer ready to pull out and just heat up, and then that's one less thing to actually think about. Try and get out and about, especially if you're having bad days or the bub's really unsettled. Getting out of the four walls of the house is really important. Quite often getting outside with the birds chirping, the leaves rustling, the babies will often be a lot more content, okay? So just getting outside, at least mum is getting a walk, she's getting a little bit of exercise and fresh air, and she's not sitting at home listening to the baby being unsettled, and the baby might often just go off to sleep in a different environment and then you'll come back all feeling a little bit refreshed, ready to take on the evening, so that's also a good strategy. Another good way to assist with the psychological impact of becoming a new mum, becoming a new dad, is for the mums to go to Mothers Group. So when you're discharged from hospital, you'll be given the information for the local area health support community health centre, and you'll make contact with them to be able to attend your first session. And they often run for a program, weeks of time, 6 to 8 weeks generally, and you go weekly with like-minded new mums. So you go to these with people going through exactly what you're going through, sleep deprived as well, with questions that you've also got. And it's a great time where you can have answers, your questions answered by nurses. And then there's a time afterwards where it's much more casual, and quite often you'll either go to a local cafe or a local restaurant or pub and all mingle. And that's a nice way to develop some relationships with mums also going through what you're going through. It gets you out of the house, it gets baby out of the house, gives you a little bit more information. You might be sitting at home wondering why baby did what they did last night, or why this keeps happening, or why you can't settle the baby. You go to a group session from your Mothers Group and you can get your questions answered, and you'll feel a lot more relieved that you know that you're not the only one going through this.